Hello, everyone. Welcome. I'm Soraya Balouche, a member of Union, and I am very proud and honored to introduce Michele David. Dr. Michele David is a primary care physician and public health leader with deep experience in health equity, patient safety, and cross-cultural medicine. She serves as the Chief Clinical Quality and Patient Safety Officer at MIT Health, where she leads system-level initiatives to improve clinical outcomes. Previously, Dr. David was an associate professor of medicine at Boston University School of Medicine, co-director of the Haitian Health Institute at Boston Medical Center, and director of community health programs at BU Center of Excellence in Women's Health. Her career has centered on addressing health disparities, and she has contributed to the development of cultural competence curricula, mentored countless trainees, and published extensively in peer-reviewed journals. Dr. David is the recipient of multiple awards, including the William A. Hinton Award for Massachusetts Health and Human Services, a leadership award from the Massachusetts Department of Public Health, and a Patient Safety Award from Atrius Health. She served on the Massachusetts Public Health Council from 2007 to 2025, appointed by the governor. In addition to her clinical work and policy work, Dr. David is an award-winning fine art quilter whose work explores themes of culture, identity, and healing. And I'd just like to add on a more personal note, Dr. David has been my physician up until very recently, and she's gone above and beyond, and I think really ensured that my health was primary. I was hospitalized a few years ago, and she came to the hospital to check on me and followed my care with my treatment team at the hospital continuously. So she really embodies everything we would want in a physician. So I'm very proud to introduce you.
Thank you so much, Soraya, for this wonderful introduction. I feel like Senator Miranda about her bio. So I wanted to talk today really about how do we thrive as Black women given the arc of history in America. And basically my objectives are to understand key health issues affecting Black women, exploring cultural and structural influences, as well as identify practical self-care and advocacy tools to ensure that our health remain good, not even good, excellent. So why does this matter? This matters because Black women live 3 to 5 years less than white women on average. So about 77 versus 80 years. And we are underrepresented in clinical studies, which means that if you're not in clinical study, how medication, how surgery, how research affect your health is not studied. So we cannot be fully a part of the medical establishment, so to speak. And also we experience the cumulative effect of racism and sexism, which impact our health. So why does it matter? Is this the weathering effort that Lisa and Senator Miranda talked about, that chronic exposure and for us is almost daily, the microaggression, et cetera, that happen in America, the economic adversity that accelerate the health deterioration in Black women. And studies have shown that, for example, in our gene, the end of our gene is called telomere, and if the telomere length is actually inversely related to age. So the shorter it is, the worse you are. And by middle age, Black women have shorter telomere than white women. So which means that we are on average 7.5 years older health-wise compared to white women. And stressors associated with perceived stress, poverty, adiposity, central obesity, which is essentially belly fat, contribute to Black and white difference in telomere length. And we also are affected by both the intersection of Black and being gendered women, because health outcomes are affected by race, gender, income, and immigration status. And it's also this intersectionality have influenced our access to care and access to treatment. And this is a map that actually shows how this is a framework for health equity indicator for cardiovascular disease, because all of this affects our health. And this is at the individual, interpersonal, organizational, community, and system level. So the presence of racism, classism, genderism, heterosexism, that impacts policy, it impacts healthcare access, and it impacts socioeconomic factors. And what that leads to is to a decrease in cardiovascular health and well-being. And this is another way of presenting the same thing. We can see that in the first column, in the gender, sexism and heterosexism issues, there's gender discrimination, there's gender income gap, there's LGBTQA plus discrimination, access to affordable health care, access to health care in the first place, access to effective and quality health care, health literacy, and living in medically underserved area impact our health. Neighborhood characteristics impact our health. You know, by zip code, we can tell how healthy the population is, by zip code. So these are all of this: social cohesion, public assistance, poverty, physical environment. When we were doing a lot of studies in our community in Boston, people couldn't exercise because there was so much crime outside. So that impacts your health, because exercise impacts cardiovascular fitness. So all of those things, so neighborhood quality matters. Policy matters. For example, having living wage policy, the amount of money that's spent per capita, which means by neighborhood, by person, matters, because we know there's differential spending by these things. Sick leave policy. A lot of people work where there's no sick leave policy. I worked for 18 years in a safety net hospital. When people came to see me, they were losing their wage. You know, and sometimes we would diagnose them with cancer, and they still couldn't come because the cancer was the least of their problem if they were about to be evicted. So these things matters. And, you know, access to mental health care. And we know there's a dearth of both primary care and mental health in America, and it's even more unequal in our community. We know that studies have showed that if you had adverse experience in childhood, you develop more chronic disease as an adult, and you're likely to die sooner than other people who did not adverse in childhood. So all of these things matters. Mental health disorder, we have more because we are so bombarded by stuff in our daily life that we have to cope with the stress that leads to sleep is affected, and sleep matters to health. The amount of social support, the stigma, the stress, all of that impact health. And then racism, you know, there's immigration status, over differential by immigration status. I mean, we're welcoming white South African, blah, 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 but we are putting other people back in situations that are horrible. So those kinds of things matters. Race consciousness, racial income gap, racial segregation by residence, all of these matter in our health. And of course, our education or employment status, the level of food insecurity, which, you know, again, in my experience at a safety net hospital, that really mattered. We saw it every day. We had to discuss these patients. At the last week of the month, I would ask patients what food they have in the refrigerator, and they wouldn't. And we would have to refer them to food pantries and stuff like that. So if you didn't ask, they wouldn't tell you. So those are the things that are really important. That's why there's a difference when black people treat black people versus other things, because people are not sensitive to those issues. Housing insecurity and income. We fought a lot, for example, for asthma, to ensure there's inspection so that children are affected by mold and they would get hospitalized for asthma. the medication wasn't going to work. They were going back to that house that was full of mold and rat and cockroaches. So those things matter. And so why are there socioeconomic disparities? It's actually, there's a history in the racial and wealth gap. As we know, unpaid labor for 246 years as slave. There's unequal treatment after emancipation, where black were allowed to deposit money was called the Freedmen Bank. And Congress decided to manage the bank versus the other white bank where white people put their money was managed through a different system. And they completely mismanaged the freedom. So whatever people had saved, it went bankrupt. And that left about over 60,000 depositors with loss of 3 million, which is in today's dollars is almost $76 million. So our wealth, our capital was destroyed. We couldn't accumulate wealth. There's also history of successful destruction. There's history of destruction of successful black neighborhood. We know about Tulsa and the black warfare. There's Woodwood, California. It wasn't just one, it was many. It happened across the US. Racial riot in New York. So all of that lead to gap in wealth. And also after emancipation, we would have legally mandated segregation in school and housing. And that lead to decreased ownership. And that also, we know that home ownership is the leading way in America we accumulate wealth. And we can pass wealth to the next generation. And those barriers to owning home and business equity, they included difficulty in securing the loan, poor information about investment opportunities, and so that racial difference in housing led to continued decreasing our wealth. And so, for example, other example is like Social Security, which was the Roosevelt New Deal, which really had an impact of creating a huge middle class in America, where we were mostly excluded from the New Deal because a lot of us worked as domestic workers, and they were specifically excluded from Social Security. And also, when the GI Bill was created, which also created a large middle class society, we were also, it was designed in a Jim Crow fashion. GI Bill job training steer black applicant to unskilled labor versus steering white applicant to skilled and unskilled labor. Therefore, they had more income de facto. The GI Bill also denied home and business loans to black applicants. So legal way where we are, cutting out of developing capital. And what is redlining? We all know what redlining looks like. It's when the FHA, which was founded by law in 1934, that was after the Great Depression. So the government actually insured loan to prevent the bankers from losing money on mortgages. What they did, they look at America and they created a map of neighborhood. Wherever black people or near neighborhood where black people live, they were painted red, and that's where the name redlining came from. And so FHA further segregation effort by refusing to insure mortgage in or near African American. And they also, until the 1950s, they actually encouraged the use of racial confidence to ensure that white neighborhood remain white. And this is what a map will look like. For example, this is a map of Boston in 1938, and you can see in red Roxbury, Dorchester, and Mattapan. So people couldn't own property. Black people who lived there, they essentially couldn't, the banker would not secure the mortgage, would not give them a mortgage. And if you look at the map, looking from that map in 1938 to now, where are the wealthiest neighborhood in Boston in 2015? Back Bay, Beacon Hill, and still Dorchester, Mattapan, Roxbury are the least valued. And also, the other way we have a wealth gap in income is that white families are more likely to receive inheritance, gift, and other family support compared to Black and Hispanic family. And the Federal Reserve Bank had studies that shows in 2020, Americans were projected to inherit about $765 billion in gift and bequests. And those bequests are mostly not taxed because of inheritance law, and they are mostly, this is mostly transfer of white wealth. And if we look at the wealth gap, even for a family who makes the same income, you still, wealth is different from income. Wealth is your income, your asset, whatever your investment, that's wealth. That's really what's important. So even at whatever level of income Blacks are, they have less wealth than white families. And so those difference in sort of in legacies, inheritance gift matters to that is why we continue to have those gaps in wealth. And you can see this in this data. So this is white wealth, and this is Black and Hispanic, and this is another category that that they couldn't show. And you can see white at every level, every year from 1989 to 2020, their health is more than everybody else. And you can see during COVID it increased, but in Black, it didn't increase at the same rate. So really a gap. So that's the gap in income and wealth. And if you look at the net worth, and you look at white and Black, and you look at the percentile, so the top percentile is the richest, actually the highest income families. These are Black wealth and white wealth by income. So even if you made millions of dollars in income, your wealth is still less as a Black person compared to a white person. And this is the bottom 20% in terms of income. There's still a little bit of this green for white people. So even poor white people have some wealth and Black people has none. And at the lowest level, you still have more. So it's a huge reason. I mean, it matters. And this is look at educational level. So you're looking at less than high school, some college, bachelor degree and advanced degree. And this is white over here and Black. So even at the highest educational standard you have achieved, you still don't have the wealth of white people. That's why all of those woke thing and those reverse discrimination, just as Lisa says, it's not reverse discrimination, it's, do no harm. That's why we need to continue to fight. And this actually is encoded, all discrimination, these disparities get encoded in our genes, so we pass it on to the next generation. And what is epigenetics? It's how the environment and experience shape our gene. So there's actually change in the DNA. It doesn't it doesn't change our DNA, but the activity of the DNA, of the gene is changed, leading to adverse outcome, and that we can actually pass to the next generation. So diet, stress, lack of exercise, pollution, smoking, trauma, and lack of nurturing in early life, all of these cause epigenetic change that can lead to adverse outcome that we unfortunately can pass on to the next generation. And some of the studies, they study Jewish people who were in the concentration camp, and they're finding their grandchildren have those trauma they suffered, they pass it on to their grandchildren and great-grandchildren. So how does epigenetic affect the body? it affects the risk of chronic diseases. So it increases your risk of cancer, diabetes, heart disease. It plays a role in brain development, in mental health and the immune response to disease. And so, but, you know, it's not all sad. The epigenetic change can actually be reversible to healthy lifestyle. So that's something we have to be mindful. While we can pass it on, we can also remove it from passing it on. Oh, what happened? And I wanted to talk about sort of the health consequence of redlining. Studies have shown now that individuals who live in redline neighborhood in the 1940s die sooner. So compared to people who were in the nicer neighborhood. And you can see that's how they grade them. So they had A, which was green, best neighborhood. B, sort of still desirable neighborhood, they might charge you slightly higher interest rate. C was they think it's a declining neighborhood. And then the red was the hazardous neighborhood, no loan. And this is sort of like people who were, this was a study that was done in New Orleans. People who live in area that was redlined in the past, they have a different in mortality for their so they it's no longer a red line, but the consequence of the redlining continues. So I'm going to sort of start talking about the impact on chronic stress and racism and all of these things and all those factors that I mentioned at the beginning. 57% of black women or more have hypertension compared to 41%. And it happened earlier in life compared to white women. There are colleagues of mine, Dr. Karma Joan, when we were fellows at where I did my training, she was doing study on how racism affects health. She was the first one that actually called it racism as opposed to chronic stress. And what she saw is, if you look at chronic disease and the curve of chronic disease, it actually was the same for white compared to black. It just happened 10 years earlier in black. So it's not our biology was different. It was just, the environment, how it impacted us, and it happened sooner compared to white population. And the other way, it affects our metabolism, chronic stress, both in terms of how we eat and the cortisol that's produced when you're stressed, increase your chance of becoming obese. And 56% of black women are obese, and that leads to higher rate of heart disease, diabetes, and polycystic ovarian syndrome. We also, 60% of black women are more likely to be diabetic compared to white women. And we also have more complication, more death and hospitalization from diabetes, higher rate of amputation, higher rate of heart disease as a consequence of diabetes. And Lily is going to talk about reproductive health, so I won't spend a long time on it. But 2 to 3 times more likely black women will have fibroid compared to white women. And it happened at a much younger age compared to white women. And they grow faster. And they are most likely to lose their reproduction because they are most likely to get hysterectomy versus to less invasive surgery compared to white women. You don't have to remove a uterus. You can do just remove the fibroid and leave the uterus in place and leaving the reproductive health of the woman intact. Endometriosis is also more likely to be undiagnosed in black versus white, and it's also happened at an earlier age. And that's a disease that causes a lot of pain. So we talk about women living with chronic pain for a long period of time before they are diagnosed. And we're also more likely to be exposed to air pollution and what we call endocrine disruptive chemical, for example, in our hair product, that lead to early puberty, early puberty in our children, and you will hear more likely from Lily about that. And the similar factor that affect cardiovascular health also affect reproductive health, sort of like the structural political context, racism, sexism, classism, leading to differential exposures to social stress, discrimination, to behavioral or nutrition. A lot of people live in what we call food desert, which means that you don't have access to affordable, healthy food. Industrial toxin, we are more exposed, and also doing our job, we are more exposed to toxin. And this leads to also in terms of changing our epigenetic weathering, but also in healthcare, we are more likely to be mismanaged, misdiagnosed, or diagnosed later than other people. And we also have the differential disease characteristic where it happened earlier and it's more severe in ourselves. So all of these are part of the health disparities in reproductive health. And as Lisa mentioned, we are also more likely to die when we are pregnant or after postpartum compared to white women. And we also, black mothers, a Kaiser study in 2020 shows that they experience more racism. They actually know it's happening to them. So while you're sick, you're being stressed by racist treatment, which doesn't do much for your health. So breast cancer also, while there is a lower incidence compared to white women, but we are more likely to die from breast cancer. And for some reason, it's more aggressive when breast cancer in black women are more aggressive than in white women. And there's something called triple negative breast cancer, which is the hormone presence in breast cancer. If you have positive hormone, estrogen, progesterone, and the third one, Herceptin, then those are better prognosis than the triple negative one. And for some reason, black women are more likely to have the triple negative breast cancer. Same thing with cervical cancer, more likely to present when it's spread, and lower risk of follow-up for abnormal pap. And as I mentioned to you, sometime because of what's happening health in your life, the abnormal test is the least of your problem because you have to deal with so many health in your life. So that's why there's less follow-up. And also, sometimes when people experience racism in healthcare, same thing, they don't want to come back. Also, HIV/AIDS are more likely to affect us, and also less likely to receive treatment because those treatments are expensive. And about 1 in 5 black women experience mental illness, and only 1 in 3 actually receive treatment. And depression and anxiety are also underdiagnosed and undertreated in black women. And there's also, some of it, there's cultural stigma and access issue, which are a barrier to receiving help for mental health. So we look at what's happening in our healthcare system, and there's a trust issue. There's actually what's called a racialized empathy gap. Like Lisa mentioned about the people thinking about the difference in pain. It's empathy regardless of anything. You're sick, and then people treat you badly on top of that because there's no empathy for you as a person. And there's many black patients really cannot find a physician who look like them because only 5% of healthcare providers are African American or black. And that does lead to barrier to understanding communication and effective clinical encounter. And that's some of the reason I did the cultural competence issue. What we observe, like when people are in training, that was way back when, like you would have an elderly black patient come into the room, and they would say, Rosie, how are you doing today? And the white woman would come in, they said, Mrs. So-and-so, how are you doing today? Subtle, but very clear difference, and you know what that feels. And also, in my career as a physician, whenever I have a black patient, they say, oh my God. They literally say, oh my God, thank God. I mean, and they don't know who I am, they don't know if I'm a good doctor or not, but just the fact that I'm a black physician, they feel they're going to be heard in a different way. And we also know when there's more primary care physicians who are black, it improves the survival of the black population. For every 10% increase in black PCP, it increased the actual mortality of the neighborhood where they practice. And black newborn treated by black physician, they're 50% less likely to die than if they are treated by white physician or providers. And if you are hospitalized, if you're having a black hospitalist versus a white popularist, you have a 27% reduction in your mortality. So it matters. So what can we do? So all of this bad news, there are stuff we can do. We can thrive. We can thrive. And as Audre Lorde said, I was so happy that Karen quoted her this morning also, caring for myself is not self-indulgence. It is self-preservation, and this is an act of political warfare. So keep that in mind. Taking care of yourself matters, because we are not expected to survive. So if you have a positive profession of racial and ethnic identity, this is associated with a more improved emotional and behavioral health. There is a racial ethnic connectedness that reduces the link between racism and adverse effect. Therefore, it's like a protective layer, a buffer against all of the trauma we suffer. Resilience, culturally rooted response to gendered racism and early racial identity predict longer telomere. You know, so you're going to outbe your age, and so it affects aging in African American women. So therefore, community, faith, spirituality are key protective matters, protective factors, so that matters. Art, music, storytelling, mutual aid are healing practices. And also for therapy and collective healing, it's really important to normalize therapy and emotional support. There's still a social stigma attached to receiving mental health care. So we really need to break that stigma. An example of sister circle, journaling, healing spaces, create positive spaces that have an improved outcome on our health and emotional well-being. And how we eat matters. Healthy, soulful adaptation support well-being. So we don't have to have the Mediterranean diet. You know, that's what's being proved. That there is healthy, soulful. As a matter of fact, the way our great-great-grandparents ate was better because they had their garden, they had their collard green. You know, they butchered their own meat, and those animals were not fed the bad thing that made red meat bad. Because if you grass-fed, beef grass-fed animals don't have the toxicity that lead to higher cholesterol profile. So our food system is actually, I call that, is toxic. So plant-based diet, healthy protein, healthy oil, you know, olive oil, canola oil, except for palm oil. Palm oil is actually a saturated fat, as well as coconut oil. Those should be limited. Whole grain matters. There's a thing people think carbohydrate is bad. Carbohydrate is not bad per se. It's processed carbohydrate that's bad. Whole grain has nutrients that our body need, that our gut microbiome, the bacteria that protect our health, they need healthy fiber, and healthy fiber is found in whole grain, in fruit, vegetable, legumes. So this is the kind of what your diet should look like. It should be colorful. each of these colors has a different chemical that protects your body. The black, anthracene, don't ask me what the other colors, chemicals are. That's the one I remember the most. And healthy protein, fish protein, legume, all of those things matters. So you should eat a rainbow of vegetables and fruit. That's what your, and these are a healthy version of our soul food. You can see your color green, and chicken and sweet potatoes. Sweet potatoes has a lot of fiber, so it's better than white potato. Exercise, joyful exercise. Do something that you like to do, so you're going to do it. So it doesn't matter to do it once a month, you have to do it at least 5 days a week. So you have to do something that you enjoy. It's not a punishment. And there's actually community models, something called Girl Trek, that get community involved in being active. So these are examples that I gave of a different organization that works to improve Black women's health. And Lily Marcelin is here as the executive director of the Resilient Sisterhood Project. The Black Health Imperative still exists and was founded by Avery, Miss Avery, which was a fervent feminist and impacted my own advocacy for women. And Girl Trek is around wellness advocacy and lifestyle change. The White Dress Project is about fibroids. And a source I like to give people for healthy nutrition, it's if you Google Harvard and nutrition, you go to the nutrition source, and this is one of the best websites I see about discussing healthy food. There's a lot of junk about healthy food, a lot of unsupported, unevidence based. For example, they're telling you to juice or to detox. Actually, there are recent studies that showing if you detox, those 3-day cleanse, those 3-day fast, have actually an adverse outcome on your life because they decrease your gut microbiome. And having a healthy microbiome is very important. You have to feed it well for you to have a healthy microbiome. Healthcare advocacy, when you're going to see a physician, it's important to know your own health history and prepare questions. Write them beforehand if you're not going to remember. Ask your grandparents, your uncle, the family, what are diseases that happen in the family, because that impacts what kind of screening studies you might need to do to make sure you keep healthy in the long run. And if you find that you're too shy, you're not assertive enough, bring somebody else with you. And sometimes if you're going to hear bad news, it's also best to have another person to hear with you, because if you get a bad news, like for example, a cancer diagnosis, the doctor can speak to you 20 minutes after that, you actually don't hear it. So it's important to have somebody else in the room who can hear what's being said and who can advocate on your behalf. And the final reflection is that, every day you need to ask yourself, what change I'm going to make today to ensure that I'm healthy? Self-care is community care. It's an act of political warfare, as Audre Lorde said. It's really important to be healthy and keep healthy. So, thank you. And I actually practice what I preach. Believe it or not, I used to be 218 pounds at my maximum. And I'm telling you, it was painful. Every step I took hurts. So weight, it matters. So, and I started losing night vision, and a physician not taking care of myself. I was diagnosed with diabetes with an A1C of 11, which is one of the highest A1C you could have. That's when I said, you're killing yourself, do something. So, yes, it's important to take care of ourselves.
Thank you for disclosing that, because a lot of times physicians won't do that and are not mandated to, but the fact that what it could be like, that's where that trust factor comes in at, from patient to physician, because they see that it's possible and the physician is disclosing something vulnerable
Mm-hmm. Mm-hmm. Um, Part of it is it's having the courage to say it, and in a way that's not, because they tend to look, a lot of people tend to look at what we say as an aggressive statement, to say it in a polite way and say, you're not hearing me, can you listen? And keep saying it. And next time, bring somebody who can be the advocate for you. But you do have to say, I know. Actually, when I go to the hospital, I don't say who I am because I want to witness what happened. And after I received the thing, and I said, I'm Dr. David, and they go, the blush, and I said, that's bias. So I use myself because I know what I can get, I will get what I need to get. But I want them to confront them with their bias. I mean, I've had people talk to me at a 6th grade level. I have people dumbing me down. I have people do, not even wanting to hear what I'm saying, and so, yeah. And if you can change system, but one has to be able to politely say, you're being treated badly, and I want to change. So Lily's organization is very good at that, about I don't know about menopause, but premenopause. But there's a website called the Menopause Society, and it has a lot of good information on menopause. I think it's menopause.org, but don't quote me on that. But if you go to Menopause Society, you will find that website. Any other question or concern? One thing also I want to say, at any weight you are, you need to be active. Physical activity is 60% more effective than medicine, studies have shown. So if you're being active, you're actually treating yourself. And by improving your cardiovascular fitness, you really improve. So at every level, for example, if you're fat and active and thin and inactive, your fat and active might have a better health than thin and inactive. So physical activity is really important, more effective than medication to prevent or to treat chronic diseases. So it's very important to be active. That's why I said find something you enjoy, whether it's dancing, walking, hiking, but something that you're going to do regularly that would help your health.
Thank you so much. This was really amazing. Yes. Yes. And look for Dr. David's artwork. We went to a showing, and it was just incredible, beautiful work. And this is just a small token of our appreciation. Thank you so much.